The overall goal of this surgical intervention is to treat patients with chronic therapy-resistant and neuropathic trigeminal pain using minimally invasive subcutaneous nerve field stimulation as a method of neuromodulation.
This method can help treat patients with therapy-resistant chronic trigeminal pain, such as trigeminal neuralgia or post-herpetic trigeminal neuropathy, who have failed conservative and standard surgical treatment.
The main advantage of this technique is that it is minimally invasive, does not destroy any nerve tissue, and its success can be tested in a period of trial stimulation before undergoing permanent implantation. We offer this treatment as an alternative to destructive techniques such as radiofrequency thermocoagulation or gamma knife radiosurgery.
After a patient has carried out a 12-day stimulation trial according to the text protocol, turn the anesthetized patient's head to the side contralateral to the pain. Then place a pillow under the ipsilateral shoulder to expose the clavicle. Shave the area around the ear on the painful side of the face. Then remove any loose hair. If necessary, tape away the surrounding hair to prevent it from moving into the surgical field. Next, thoroughly disinfect the surgical field from the facial area around the ear and down to the clavicle area. From the x-rays of the outpatient appointment, use a sterile surgical pen to mark the desired position of the permanent electrodes and the marks of the previous skin punctures for guidance.